Hello there, welcome to ShineTech's YouTube channel. In this video, I'm going to go through anatomy MCQs on the hip region and the thigh. Question 1 reads, concerning the hip joint, A. Accessory obturator nerve is one of the nerves supplying the joint. B. It's commonly dislocated in extended and medially rotated position. C. The acetabulum is deepened by the labrum glenoidal. D. Stability is mainly due to intrinsic ligaments. And E. Each muscle acting on the joint has a base. So concerning the hip joint, the correct answer here is A. Accessory obturator nerve is one of the nerves supplying the joint. So this here in this diagram is the hip joint, and these are the nerves originating from the sacral and lumbar plexus. So this here is the femoral nerve. In pink is the obturator accessory nerve. So we could see there when reaching on the hip joint, it is giving branches to supply the hip joint. That's why we are saying A is correct, because accessory obturator nerve is one of the nerves supplying the joint. So question 1, correct answer is A. We move on to question 2. Question 2 reads, concerning the head of the femur, the following are true except A. The ligament of head contains a branch from the obturator artery. B. Neck fracture damages the reticular vessels and may be followed by a vascular necrosis. C. Is surrounded by an articular capsule that is deficient posteriorly. And D. Forms 2/3 of a sphere. E. It is directed medially, superiorly, and posteriorly. So concerning the head of the femur, all of these are true except one. So except E. E is false. All of these are true. Why? Because the head of the femur is directed medially, superiorly, and anteriorly, not posteriorly. So in this diagram here, this is the head of the femur forming part of the hip joint. So you could see here, the head of the femur there is directed superiorly, okay, medially, and anteriorly. That's how it is directed, not posteriorly. So that's why we are saying E is wrong. It is not true because it is anteriorly instead of posteriorly. So question 2, the correct answer is E. We move on to question 3. The synovial membrane of the hip joint lines the following structures except the synovial membrane of the hip joint lines the following structures except A. Inner surface of the capsule, B. Acetabular pad, C. Ligament of femoral head, D. Head of the femur, E. Intracapsular neck of femur. So which one of these choices here is wrong, or it is not lined by the synovial membrane? So this is the hip joint, and you could see we have the ligament there and the capsule. Then from there we have the articular cartilages, and we also have the synovial fluid. So but our concern here is to see what is lined by the synovial membrane. So in this diagram we could see that the ligament and the capsule of this joint are lined by the synovial membrane, okay, except for the head. This is the head of the femur, but the neck is lined by the synovial membrane there. The synovial membrane is lining the ligament and the capsule this side, and the part of the neck of the femur, except for the head. So on our question here, except D, which is the head of the femur. So the synovial membrane will line all of these except the head of the femur. So the correct answer is D, except D. Question 4. Which of the following muscles flexes both the hip and knee joints? A. Quadriceps. B. Adductor magnus. C. sartorius. D. semimembranosus. And E. gracilis. So which one of these muscles flexes both the hip and the knee joint? So the correct answer here is C. Sartorius is going to flex both the hip and the knee joint. So this is the sartorius muscle. It is originating from the iliac crest there. Okay, so it is originating on the anterior superior iliac spine. So on the iliac spine, and it is inserting on the tibia tuberosity. So if this muscle contract, it's going to flex. It's going to flex the femur, and it is also going to flex the leg there. Okay, so it flexes both the hip and the knee joint. Correct answer is sartorius muscle. So question 5. The artery accompanying the ligamentum teres is a branch of A. femoral artery, B. inferior gluteal artery, C. superior gluteal artery, D. medial circumflex femoral artery, and E. obturator artery. Okay, so which one of these is the artery which is accompanying the ligamentum teres? But before that, what is this ligamentum teres? So ligamentum teres is this ligament which is found on the head of the femur. So this ligament here is what we call the ligamentum teres. So the artery which is accompanying that ligament there is a branch of obturator artery. So the correct answer here is E. We have the obturator artery this side, then a branch of the obturator artery is going to pass through the ligamentum teres. Okay, so the correct answer is E. So we move on to question 6. Remember, don't forget to like, subscribe, and leave your comment concerning this video in the comment section below. Question 6. The major blood supply to the head of the femur is through A. the ligamentum teres, B. the nutrient artery, C. the retinacular vessels, D. all of the above, and E. none of the above. So which of these is the major blood supply to the head of the femur? So the major blood supply to the head of the femur is the retinacular vessels. The retinacular vessels are the vessels supplying the head of the femur. Question 6, the correct answer is C. So let's see. So in this diagram here, we could see blood supply to the head of the femur, and these branches here are called the retinacular vessels. They are coming from the medial circumflex femoral artery and the lateral. So this is the lateral circumflex femoral artery. They are going to give off branches which are called retinacular vessels, which are going to supply the head of the femur. So the head of the femur is supplied blood by the retinacular vessels. Question 6, correct answer is C. Move on to question 7. Question 7. All the following supply the hip joint except A. the obturator nerve, B. the accessory obturator nerve, C. the femoral nerve, D. the nerve to quadratus femoris, and E. none of the above. Okay, so on this question here, all of these are going to supply the hip joint. Okay, except which one? Except none. because all of them, the obturator nerve is going to supply the hip joint. The accessory obturator nerve, as we have seen in question 1, it is also supplying the hip joint. The femoral nerve is supplying the hip joint. And D, the nerve to quadratus femoris, is also supplies the hip joint. Now, except none. So E is the correct answer. Except none. None of these is accepted, meaning they all supply the joint. So we move on to question 8. The following is true of the ligament of the head of the femur, except A, it is not a major factor in preventing dislocation of the hip joint. B, it is completely surrounded by synovial membrane. C, attaches to the margins of the acetabular notch. D, transmits blood vessels. And E, prevents hyperabduction of the hip joint. So which one among these is false? The question is saying the following is true, okay, concerning the ligament of the head of the femur. So ligament of the head of the femur is ligamentum teres, the one we are talking about. So except which one? So all of these, they are true except E. Okay, so when you look at that ligament we saw in this ligament here in question 6, this is the ligament of the head of the femur. So that is the head of the femur, this ligamentum teres. So the function of that ligament, it is going to prevent dislocation of the hip joint because it stabilizes the joint, and then from there it is completely surrounded by the synovial membrane. Then it is also transmitting that vessel we talked about, which is coming from the obturator artery. Okay, so the one which is except E. So E, prevent hyperabduction at the hip joint. So the ligaments which are providing or which prevent hyperabduction at the hip joint are these ligaments here. Okay, so we have iliofemoral ligament and pubofemoral ligament. So especially pubofemoral ligament, that ligament which is found inside there, it is going to prevent excessive abduction, and this one, it is going to prevent excessive extension. Okay, so except E, the ligamentum of the head of the femur is not responsible for prevention of hyperabduction at the hip joint. So except E. So question 8, the correct answer is E. Question 9, the hip joint is mostly unstable, easily dislocates when it is in the following positions: A, extension and abduction. B, flexion and abduction. C, lateral rotation and extension. And D, anatomical position. And E, flexion, medial rotation and abduction. So the hip joint is mostly unstable when it is in flexion, medial rotation and abduction. So the correct answer here is E. When it is flexed, medially rotated and abducted, then we can say it is unstable in that position. Question 9, correct answer is E. Question 10, find the true statement on the hip joint. Find the true statement on the hip joint. A, it has 4 ligaments. B, its blood supply follows 3 routes, the most important of which comes from the obturator artery along the round ligament. C, its socket is deepened by labrum glenoidal. And D, the transverse ligament limits extension. E, the Pethels disease is one of the cause of a positive Trendelenburg sign. Trendelenburg sign. So question 10, the true statement on the hip joint is E. Pethel's disease is one of the causes of positive Trendelenburg sign. So this sign is this one in this diagram here, where this one is the normal position when you are being supported by one limb. You must be in this position here, so that plane there must be straight. Okay, now in Lendenberg sign, what will happen is that when you are being supported by one limb, that line there is going to drop to the other side due to weakness in this joint here, okay, which is caused by Pethel's disease. So Pethel's disease is when we have disruption of blood vessels which are supplying the head of the femur there. So what will happen is that we are going to have weakness in that joint, and also the muscle there, which is gluteus medius, which supports that joint, is also weakened. So what will happen is that when you are standing on one leg, what will happen is the weakened part is going to be raised up, and the part which is normal is going to be lowered, causing this type of sign, which is called the Trendelenburg sign. Okay, so the true statement is E for question 10. Okay, so let's move on to question 11. So the primary abductor of the hip joint is A. obturator externus, B. piriformis, C. pectineus, D. gluteus medius, and E. sartorius. Okay, so for question 11, try to find the correct answer, and let me see your correct answer in the comment section below, and look for the other part of this video in the video playlist, in my video playlist, to find the correct answer for question 11. Thank you so much for watching. Don't forget to like, subscribe, and leave your comment in the comment section below.